Ocala's information station, 1370 WOCA.
Ocala!
All right, 5 minutes after 9 o'clock, it is time for Veterans News, a special 1 hour Veterans News today. And Hank Whittier is in the studio. Good morning, Hank.
Hey, good morning, guys. It is an hour program. We have Dr. Knapp here from the VA and the local clinic to talk about some issues you need to be concerned about, at least be knowledgeable of. And we have some other things to talk about. But, unfortunately, we do have several casualties this morning. And I think you've got the list already?
Yes, we have 2 law enforcement casualties, and we have a Department of Defense casualty. Our law enforcement casualties are Sergeant Jeffrey Wayne Green of the Union County Sheriff's Department in Union County, North Carolina. And I'd like to mention that Sergeant Green was also a veteran of both the United States Air Force and the United States Marine Corps. And we also have Police Officer Justin Weinbrenner of the Akron, Ohio Police Department. His end of watch was Sunday, November 16th, 2014. And we do have 1 Department of Defense casualty, as I mentioned, United States Army Sergeant First Class Michael A. Cathcart, who was killed on November 14th. He was from the 3rd Special Forces Group of Fort Gregg, North Carolina, but he died in Afghanistan. And we would like to remember these folks and especially their families, and that our thoughts and prayers be with them.
Okay, anybody local you want to mention at all? Yeah, I got one. Rich Bryan passed on, long battle with cancer, and finally succumbed to that. Rich was a veteran, and we knew him well. Anyway, Larry, if you would, buddy.
Amazing grace, how sweet the sound that saved a wretch like me. I once was lost, but now I'm found. Was blind, but now I see.
You're going to do your weather report. We'll start off with good news. 65 today and only down to about 40 tonight. So the news is getting better. And the rest of the story is you don't live in Buffalo, right?
That's right.
Okay. So, Gary, you've got, what makes this all possible. And talk about Bob Wines and all the guys, right?
Yeah, go ahead.
Good morning, everyone. As you can see, the weather outside is a little nippy, but if you have some issues with your plants, you need to go by and see Bob Wines Camellia Garden and Nursery. They're located at 2610 Southeast 38th Street here in Ocala. And they know the plants and trees that will survive the weather when it gets down like this. So if you're having landscaping or nursery or plant issues, you need to go by and see Bob Wines at Camellia Garden and Nursery. When it comes to landscaping, Bob Wines has what you need, everything from small plants to large trees, mulch, fertilizer, and anything else that you might need. They will deliver, plant, and they guarantee their plants. Bob Wines has been in business since 1952, and for the veterans out there, Bob Wines offers a 10% discount to all veterans. And you can contact Bob Wines Camellia Garden and Nursery at 352-629-5766.
Probably after the freeze we have, we'll be all doing some more planting, right? And Bob Wines is the place to get it. All right, listen, we have Dr. Nappy. I'm going to let him introduce everybody, because I'll certainly not get the titles correct, especially Bill's, but Dr. Bill.
Very good. Well, thank you very much. It's our pleasure to be here again this month, and we're thankful that we have a full hour show, and I've brought three of our mental health providers from the Cascades, Dr. William Gambarino, psychiatry, Dr. Adam Hunt, mental health social work, and Dr. Bosco Lorio, psychology. And as we've talked on this radio program in the past 2 years, there's been a tremendous expansion of the mental health program over at the Cascades, and our access we'll talk about has really dramatically improved. So let me start with Dr. Gambarino. Dr. Gambarino, mental health at the Cascades in the last 2 years has dramatically expanded under your leadership. Can you give us an overview of what we offer at the clinic?
Oh, absolutely. I've been affiliated with the North Florida, South Georgia VA system for 15 years now, and I've been excited to see a great deal of expansion in mental health across the entire system, but in Ocala in particular. Just to give you an example, in 2006, when I started in the clinic, I had just a couple days a week there myself. So we had 2 days a week of psychiatry, one psychologist, and that was it. At this point, we now have 2.5 psychiatrists full-time, 3 psychologists full-time, and 2 licensed clinical social workers who provide mental health therapy full-time. So we have a great deal more access than we did just a few years ago.
It's tremendous. Dr. Gambarino is very modest, but he worked in the community here in Ocala, and wherever you go in the community, everybody knows him and speaks so highly of him. He also is in charge of literally all the mental health and all the clinics, the CBOCs in Florida and Georgia. So he has many hats and is doing a wonderful job. We treat a lot of different mental health diagnoses. So, Dr. Lorio, let me ask you, what are some of the common mental health problems we treat in the clinic?
A lot of the most common diagnoses that we work with are individuals with anxiety disorders, depression, post-traumatic stress disorder. There are a lot of veterans also who've been recently diagnosed with medical issues and are having a hard time adjusting to that. So a lot of counseling and adjusting to accepting that diagnosis and kind of coping with it are some of the most common diagnoses we get, as well as couples and family, particularly the younger vets that are coming back whose family's having a hard time kind of dealing with what's going on with the individual. So we do provide families and couples therapy as well.
That's great. We have a new program that you piloted with Dr. Pan and Jason. Can you tell us about primary care mental health integration and what we're offering now at the clinic?
So the three of us, Dr. McClavey and Dr. Pan, work in the mental health clinic, and we also work sometimes at the primary care clinic, which is basically kind of brief-oriented and solution-focused therapy. So we see the veteran at that time after they've seen their primary care provider. They'll walk them over to our office. We'll do a brief evaluation and then see them for a couple, 4 to 6 sessions at that moment. If it's deemed at that time that, maybe it's something more intensive that they need, then we refer them downstairs to our mental health clinic for more long-term. But they do have access to seeing somebody within mental health that same day after their appointment with their primary care.
It's a wonderful service. Hank, when we talk in the community, we mentioned that you can actually get same-day mental health service at the clinic.
Yeah, that's very unusual, and it's certainly a tremendous improvement from where we were not that long ago. So I know the VA has sort of focused mental health funding, but a lot of it has to do with, the demands in the community and support from you people. So it really is. It's an unusual service that they can do that. That's fantastic. Can I ask you a question, and it's mainly for you, Dr. Gambarino. Does Ocala staffing, in terms of its mental health staffing, is that comparable to some of the other clinics around the North Florida? I mean, are we all sort of in the same boat, or is it just based on, obviously, for instance, the villages? It might be a good example. How do we compare with the villages in terms of our staffing?
It's a good question, and each clinic has their own unique circumstances, their own unique population, and each clinic has its own size. Ocala happens to be the largest of the community-based outpatient clinics. It's smaller than the Villages, which is a multi-specialty clinic. It's a higher tier facility. But as far as the community-based outpatient clinics go, Ocala is the largest. We have one of, if not the largest, mental health staffing, but I would say that we still have room to grow in terms of caring for the larger population we deal with in the area. And one of the things I'm hoping to do is to bring in, for example, substance abuse therapists to the clinic. We used to have that in the past, but due to shifting of positions, that position was reallocated to the Villages, and I'm hoping to bring back a substance abuse therapist in Ocala at some point in the near future.
Hank, we have to take a break.
Sure.
And we'll
Go the weather break.
Yeah.
Okay.
And we'll be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. It'll be partly sunny today and milder this afternoon with a high of 64 to 70. Tonight, mainly clear and chilly, lows ranging from the lower 40s in a few inland spots to the upper 50s along the coast. Tomorrow, partly sunny with a high of 71 to 75. On Saturday, times of clouds and sunshine, breezy and warm, high 74 to 78. From the Florida Weather Center, I'm meteorologist Joe Lundberg.
Career Source, Citrus, Levy, Marion brings together business and community partners, economic development leaders, and educational providers to connect employers with qualified, skilled talent and job seekers with employment and career development opportunities. Tune in the first and third Wednesday of each month at 9:30 a.m. to Career Source, Citrus, Levy, Marion, and learn how they can help you.
Hi, my name is Dr. Erica Olstein with A Better You Healthcare Acupuncture and Eastern Medicine. As primary care physicians, we use acupuncture to treat back pain, arthritis, migraines, allergies, high blood pressure, thyroid disorders, hormone imbalances, stress, and more using all natural medical therapies. We treat the source of your problems, not just your symptoms. For more information, go to abetteryouhealthcare.com or call today to set up your appointment, 352-615-5566.
Dad's service to our country is something we're all proud of. He made a difference and set a great example. Now it's our turn to honor the sacrifices he made for our family and his country. As Veterans Funeral Specialist, Hyers-Baxley Funeral Services helped us celebrate Dad's life, and they can help you too. Hyers-Baxley is here for you during your time of need or when planning for the future. For more information, call 352-484-0891 or visit hyers-baxley.com/choice.
Hey, I'm Gary. And I'm Eric. Did you know that Red Eye Radio is on WOCA The Source every night from 2 to 6 a.m. and it's live?
That's right. No tape shows here.
We know that the news doesn't sleep.
And neither do we. So we're here with you live from 2 till 6 a.m. every weekday. Call us 866-90-RED-EYE. So join me, Gary McNamara.
And me, Eric Harley, every weeknight to discuss the latest in news and entertainment.
Right here on WOCA The Source.
Hey, Matt, I know Sunrise Automotive does auto stuff, but I need some tires for my truck. Can you recommend someone?
Yes, I can. We do that.
No, I mean, I need them installed and balanced and all that.
Yep, we do that.
Well, my son needed his windows tinted.
Yep, we do that.
I need my seat replaced.
Yep, we do that too.
I need a new roof line and a new spoiler and a new trunk.
We can even do that too.
Okay, I get it. I suppose you can also do a radio show too, huh?
Well, as a matter of fact, join me every Monday at 10 for auto repair with personal care here on The Source.
Of course you do.
All right, 19 minutes after 9 o'clock, let's return to Veterans News and Hank Whittier.
Hey, we're back. I know you got a lot to cover, but, just from a veteran's point of view, because I use that clinic too. And, for years, those of us who advocate on behalf of veterans have been asking the same question of the VA. And that's when we're going to get more space at the VA clinic locally here in Ocala.
Well, as you know, we hoped that we were going to be in our an extra 3,100 square feet a couple of years ago, and we do have plans. They're finished. They're signed off by the VA. I think what happened this year, Hank, is, as you know, we've had 3 VA secretaries in about 3 months. We had the old one, the one that was temporary, and then the new one, Bob McDonald, who came on board. And we got kind of caught in the middle of all that, where everything is temporarily on hold. So I do not have an update for you today, but I will tell everybody who's listening that our goal is to expand mental health from the 2,000 square feet they have to 3,100 square feet in another footprint at the Cascades. And we are just hoping that we are given the go-ahead so the first sledgehammer will go through the wall.
Yeah.
But plans have been finished. I think your question is, how is Dr. Gambarino running his department with no space? And he came up with a pretty novel idea, which I think is new to you, and he came up with 10-hour shifts, and I'll let him talk about that.
Well, any new idea is novel to me.
Yeah, when faced with this challenge of trying to bring on some additional staff that we actually had positions for but no room for, we tried to think a little bit outside the box. So we created an office sharing arrangement where we're having folks rotate on 10-hour shifts and share offices so that we could actually fit more staff into the same number of rooms. And it's allowed us, at least temporarily, to increase the number of providers seeing veterans in the clinic, and hopefully we'll have new space in the not-too-distant future, and we can add some additional providers.
There have been a lot of studies done, and I don't have to tell you gentlemen because you're all in the psychology, you're in that field, but about what overcrowding does to people, both staff and patients. And even going in, when I go in and when there's a large crowd, I mean, you have a reaction to that. And it's not, I'm not putting it on you folks. I mean, I've talked to, and a lot of people at the table here, I've talked to both congressmen in town, both Yoho and and Nugent, and have been assured that that was going to be resolved because this clinic, again, in my opinion, is getting shortchanged by not having more space that's needed. So it sounds, again, like we're being put on, and no fault of yours, that this VA clinic here is being put on the back burner again by the VA for some reason. Now, whether it's changes in secretary or, but I 5 years ago when I talked to those folks in Gainesville, they assured me that was going to happen, and the congressmen assured me that's going to happen, and it still hasn't happened. And 5 years later, we're still talking about, that's innovative, and I appreciate you all doing the 10-hour shifts, but I've heard from, for instance, female veterans who have complained about the lack of privacy, and other veterans who say, hey, we're stacked on top of each other. Do you still have those sound suppressors downstairs so people can't hear?
Yes.
Yeah. So, because you don't have the space, you're forced to be using those sort of things. And it's just not, I don't think it's the most conducive. You do a great job, and I pat the clinic on the back because you guys do great. But there's something amiss in the funding stream within the VA that this particular clinic doesn't seem to get the attention it needs to get. So, you veterans out there, I don't know if any of you use that clinic, but I think it's an issue that we need to address. And again, it's not pointing your finger at you, but because you do a good job.
We want all the veterans out there to be using our clinic, and that's one of the reasons we're on the radio. And let me follow that up, Hank, and next month, let me see if I can get some clarity. But Bill and myself will talk about this daily, and we're involved in the middle of that. Before we go on to PTSD, I just wanted to mention to you, with Bill coming up with the idea of 10-hour shifts and hiring an added psychiatrist a couple months ago, as you know, that really increased our access. For example, our access right now to see a new patient to see psychiatry, a new veteran, is literally measured in a couple weeks. And if you come into the clinic and you need to see a psychiatrist, you can be seen within the same week. And to see Dr. Lorio, you can be seen in the same day. So our access has improved just dramatically in the last 90 days.
Yeah. Well, again, I applaud it. It's outstanding. Get some innovative ideas. Again, I don't want to monopolize all the questions. So if people want to call in, I guess Larry can tell them the call-in number. And I know you want to talk about PTSD. Larry, you want to blast them with that call-in number?
Sure. If you want to call in, the show's a full hour today, so you got another 36 minutes if you want to call in the number. But call as soon as you can. The number is 622-9622. That's 622-WOCA.
Okay. If I just one more real basic, simple question, because you're talking to everybody at the table, a layman. None of us are clinicians, and most of the folks listening the same way. But that's right. You're going to give me a bigger mic, make me feel important, right? But just tell us what you got psychologists and psychiatrists there. And they're both seeing patients. So wherein lies the difference for the layperson, for all of us to understand? What do you do that they don't do?
Sure.
Okay.
As a psychiatrist, I'm a physician. I went to medical school and then trained in mental health treatment. And as a psychiatrist, I am able to prescribe medications. So that's probably the biggest difference within the VA is we all diagnose and treat mental illness, but you're going to see a psychiatrist for the specialized knowledge and ability to treat with medications. We have licensed clinical social workers like Adam and like I mentioned, 3 psychologists that are all able to do different types of psychotherapy or talk therapy, including some of the what we call evidence-based psychotherapies, which are types of treatment that have been demonstrated to be effective in research.
Okay, good. Very good. All right, let's move on to PTSD, which is usually our biggest topic when we discuss mental health. Dr. Hutton, let's move on to you. Can you tell us about PTSD and how often you encounter this diagnosis and some of the symptoms of PTSD?
Sure. Post-traumatic stress disorder, or PTSD, is it's a fairly chronic condition, and a lot of the people I encountered didn't even know they had PTSD until they had urging from their spouse or significant other to seek treatment. It can happen with one very traumatic event or several smaller events, and the symptoms are what's called hypervigilance, being very anxious or having a lot of apprehension that something bad's going to happen, difficulty with sleep, not liking being around crowds, social isolation, depression, and anxiety. So I see this a lot. At least probably 40 to 50% of people that I see have been diagnosed or are diagnosed later with PTSD. But there's a lot of great treatment as well. So.
I think, Don, you had a question about traumatic brain injury and PTSD, and
absolutely. Recently, I hear this recognition that combat and non-combat concussions have been contributed to this type of injuries that the veterans have, such as its relation to PTSD. In other words, and like in hearing, brain damage, eyes, ears, sleep disorder, a lot of things that are bringing that up. And
I guess your question is, does traumatic brain injury, do veterans with traumatic brain injury have a number of other mental health diagnoses such as PTSD? Dr. Hutton?
TBI, or traumatic brain injury, from anywhere from mild to severe, when combined with PTSD, it can cause a lot of difficulties for the veteran and their family. One similarity, traumatic brain injury, which if it affects the frontal lobe, which is where someone can usually stop themselves from being aggressive or being easily agitated, if that's damaged, especially with traumatic brain injury, that can cause a lot of problems in someone's life. PTSD is similar in the aspect that agitation is a very common feature, and so if someone is diagnosed with both, it's another aspect or hurdle that needs to be addressed.
Definitely.
The other thing I would just mention is that when you think about the origin of traumatic brain injury and PTSD, many times the same source, can cause both conditions. Traumatic brain injury is, obviously the result of some type of either concussive injury or blunt trauma to the individual, which, in many cases is an explosion or some other life-threatening situation. And then the psychological sequelae from that can result in the post-traumatic stress disorder, reliving that experience, and all the other symptoms that have already been mentioned.
Our group at the Cascades actually has been involved in learning and developing new therapies, especially group therapies for PTSD. So, Dr. Lorio, can you tell us a little bit about some of the therapies that we have for veterans with PTSD at the clinic?
Sure. Similar to what Dr. Gambarino said, there's a lot of evidence-based psychotherapy. Again, that's treatment that has been researched by the VA and deemed to have benefits for our vets. Two of them that we provide at the clinic is cognitive processing therapy, which again it's a 12-session weekly approach with the veteran that has them write out their trauma, and it takes that cognitive behavioral approach, which again is kind of saying,
sorry,
that's okay.
We just need to interrupt. I hated to do it that way. We need to go take a break, and we'll be right back.
Fox News Radio, I'm Lillian Wu. Students forced to take cover in book aisles during a shooting at a school library at Florida State University overnight.
Students were studying in the library when the shots started after midnight.
We heard a gunshot, then we started hearing sirens,
leaving 3 students hurt. Tallahassee police spokesman Dave Northway says the gunman was told to drop the weapon and didn't.
Fox Radio's Tanya J. Powers, gunman allegedly fired at officers who then shot and killed him. President laying out plans for executive action on immigration reform tonight.
Everybody agrees that our immigration system is broken.
Republican Congressman Ted Cruz told the Kelly File the GOP needs to rein in the president,
so that the president does not become an unaccountable monarch.
Republicans are threatening to withhold funding for immigration initiatives.
Fox Radio's Rachel Sutherland and director Mike Nichols has died. The husband of anchor Diane Sawyer was 83. Fox News, we report, you decide.
Okay, the Atlanta trip. I have the rental car receipt, but no proof that I actually flew there. I have 2 breakfast receipts, but no dinners, and apparently I slept in the lobby because I have nothing from the hotel.
Traveling for work is work enough. Concur makes it easy. Your business travelers take pictures of receipts and submit expense reports from their smartphones. With Concur, they get to throw away the receipts, you get to rule the budget, and everyone goes home happy. Test drive it free at tryconcur.com.
Pete's Parrot Emporium.
Pete? Pete?
How may I help you?
Help! Help!
Be quiet.
Quiet! Quiet!
Silence.
Silence!
If only everything in business was as easy as Wix. Wix's drag-and-drop website builder makes it simple to create your stunning website yourself. Just choose a design from hundreds of beautiful Wix templates and customize it however you want. Go to Wix.com today. It's easy and free.
Wix.com.
This year, thanks to the efforts of the Bad Gift Givers Anonymous Association for the Givers of Bad Gifts, better known as the BGGA, the ratio of bad gift giving has been drastically reduced since our last commercial. But there is still much work to be done, and we need your help. Ties and sweaters just won't do this year. Join the thousands, nay, hundreds of thousands of smart people who said enough is enough and went to Ocala Aviation, where they purchased the gift above all other gifts, the present that soars above all other presents, the one that makes your friends jealous that they didn't think of it first. That's right, I'm talking about a discovery flight from Ocala Aviation. Whatever bad gift you were thinking of, stop. We're here to help. Let us convert that bad idea into a great one. For only $99, you can give the gift of flight, a discovery flight from Ocala Aviation. Call today. It's not too late. 861-7484. That's 861-7484.
Hi, I'm Leah Caruso with Strive Rehabilitation, inviting you to join me Thursday at 11 a.m. for Health Matters. Ocala Health and Strive have teamed up to bring you the latest information on good health services available to you right here at home. This vital information will help you make informed decisions about your health. So don't forget to join me here at 11 a.m. Thursday. It's news you can use from Ocala Health, Strive, and your friends here at WOCA.
Cookies, 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 cookies.
When you want something special and fun for any occasion, get cookies. That's right. The Great American Cookie Company in the Paddock Mall, Ocala will make a delicious, fun-filled delight just for you. You might notice that I said fun and delicious more than once. That's because I can't say it enough. The next time you're at the mall, be sure and stop by or call 352-237-2557 to place your order.
Cookies, cookies,
Yum.
cookies, cookies. We go cookie eating cookies.
The Great American Cookie Company.
Stay informed on everything going on in the Villages with the Village Spectator newspaper. The Village Spectator is exclusively devoted to the Villages with news, commentary, and more. And yes, they have Tom's Picks, a free referral for people who are looking for a company to do work for them. Tom's Picks will refer the company that fits your needs, and all we ask is that you tell them where you heard about them. Call Tom's Picks at 804-1223 and pick up your copy of the Village Spectator today.
Now read Ocala Downtown newspaper online.
All right, 25 minutes before 10 o'clock, let's return to Veterans News with Hank Whittier. And if you have a question during the course of the show, you may call in. The number is 622-9622-622 WOCA. And I apologize again for interrupting.
Yeah, we're kind of, again, if you want to interrupt us, because a lot of us have questions, but Doctor, you were kind of in the midst of something when Larry cut you off. Larry has a compulsive disorder, too.
So kind of going with the evidence-based treatments for PTSD, we're talking about cognitive processing therapy. Again, being a 12-session weekly approach that we use with our vets, they write out their trauma, and it's kind of helping them particularly process the feelings of blame and fault that they kind of feel and guilt regarding the event that happened. The other evidence-based treatment is called prolonged exposure. That one's about 12 to 18 sessions, again, weekly. And that one is having the veteran recount verbally the traumatic event, and they record it, and then they listen back to it every single day, as well as we do other approaches like grounding and relaxation, so that when they're listening to that, they kind of know what tools to use if they feel that they're being what we call activated by listening to the event. And then recently the VA rolled out a group which is called stress inoculation therapy. It's in a group setting, and those are for the veterans that maybe are a little bit apprehensive, or they feel that they're not ready to actually deal with their trauma. And that one is 12 weeks, and it looks at the symptoms. So a lot of education is given to them, a lot of skills and coping skills are given to them, so that they can kind of at least deal with a lot of their symptoms, and then ultimately come around and say, okay, I'm kind of ready to take it to the next step and do more intensive work. So as of now, those are the 3 evidence-based treatment approaches for PTSD rolled out by the VA at this time.
And what do we offer at the clinic right now, or planning to offer?
We offer CPT, and we offer the SIT group. As of this moment, I think there's one provider that I think has done some training in prolonged exposure but is not certified yet. I've also done some training during my internship but not certified yet. But we do have one provider at the villages that is willing to see some of those vets if that's their choice. And then we'll kind of trade off, and then we'll take some of the CPT individuals who are interested in that approach.
Very good. We're going to interrupt again. Bob Wines is good enough to sponsor our program, so let's put a plug in for Bob Wines again. Then
a special plug, Doctor, because, since we're talking about mental health today, there's nothing takes away depression better, for myself, than seeing the beauty of nature, especially in flowers and trees. And there's all kinds of beautiful flowers and trees at Bob Wines. They're located again at 2610 Southeast 38th Street in our own beautiful Ocala. And, when it comes to landscaping, they got it all. Get down there. If you lost something in the freeze, now's a great time to replace it. Bob Wines will deliver it if you can't pick it up. They've been keeping things blooming since 1952. And don't forget to tell them you heard about them on WOCA radio. And if you're a vet, get that 10% discount.
Well, while you're talking, let me talk a little bit about the stand down, because some of these people will be there, and we're talking about mental health and the veteran community. You want to mention the stand down you're planning?
Yeah, we're planning a stand down for homeless and needy veterans, and we're going to hold it at the beautiful Tuscaloosa Park in Ocala. The city's been kind enough to let us use it, and we're going to be primarily in the American Legion building and the surrounding area. But we're going to try to have every asset there for the homeless and needy veterans to get them out of the situations they're in and to improve their lifestyle. We've invited everybody, all the service agencies. The Ocala Clinic is working very closely with us. We've got folks from Gainesville going to come down and help us out to almost meet every need, from getting registered to getting clothing to getting personal hygiene items. We're going to have specifically, we're going to have a van down there that's going to deal in mental health. I'm trying to get a van for Dr. Knapp that he'd be able to do some medical exams in, but if not, we'll have a space for him inside. Just so many good things, there's no reason for a veteran to be homeless, and we can truly end homelessness for veterans. In Ocala, anyway. I can't speak for other places because we have a great bunch of people here, and come and get involved in this. And if you want to get involved and you're not, you can contact me. My name is Gary, and I'm at 352-433-2320.
Yeah, and the good news, it's really we're reaching out to all veterans, and mental health is going to be a big part of that, because that's really, you can't help them until you get them into treatment. You can do some things for them, and there's been a reluctance. We met a fellow the other night down at a charity event we were doing who was really having a lot of problems, and tried to get him to come up and, access treatment, and hasn't shown up yet. So that's part of the issue, is getting a hold of them and trying to convince them that there's help available, but you need to make that first step and call these folks or call us, and because help's a lot more available today than it ever has been before. All right. I think David had a good question also.
A lot of our vets are apprehensive about seeking treatment for their mental disorders that they may have. What is the process to get into the services that the clinic provides here, Dr. Knapp? And is it discreet? And how is it determined what type of help, psychological or psychiatric help, that they may need when they get into this program?
We try to make it as easy as possible, so there really isn't a wrong way to get access. Most veterans will go through their primary care doctors. For many of these conditions, they can actually be seen in primary care by one of our primary care psychologists, and that way they're not even necessarily, going to mental health. But if they do have a condition that would be best treated longer term and by a mental health specialty provider, they can be referred by their primary care doc. They can be referred through the primary care psychologist, or they can even present to mental health directly, either by phone or in person. And we'll do everything we can to accommodate getting them seen as quickly as possible.
Yeah, we're seeing patients so fast these days. Last night, as I was leaving the clinic, we were offering a new patient that came to the clinic an appointment that he didn't even want so quickly. And I think Hank is correct. The big problem we have with access now is just getting the veterans to call and getting enrolled in the clinic. One of the employees came up to me at 7 o'clock this morning. She had someone that from her church that she wanted to get involved in the clinic, and the veteran was hesitant. So if you're out there and you need mental health services, it's easy, it's friendly, and we take great care of you. We have a wonderful staff, so please call or come over to the Cascades.
Yeah, kind of piggybacking onto that, because what we get a lot of calls from family members. It's the wife, the mother. A lot of times it's the mother and father now, because these young men are coming and women are coming back to the house, and they're not what they were when they left. So I guess the question is, what do they do? Who do they call? What's their first step? They've got a son and a daughter just get back from Iraq. They're having a lot of issues. Maybe they're drinking, maybe they're drugging, and they're acting inappropriately. What do they need to do? What's their first step?
Well, let me just tell you, the first step they should do is come right to the clinic. Come right to the clinic, get enrolled. We can even see you same day if you need to be seen in primary care. We make the referral, and I've used the example on this radio many, many times. We have veterans that are in jail on a daily basis, and the veteran court system really takes care of our veterans with Judge McCoon and everything. And I'll give you an example of what we do with our veterans who get out of jail. We get a call from Judge McCoon at 12 o'clock. Our veterans are seen by primary care at 2 o'clock. They're in the lab at 2:30. And at 3 o'clock, Dr. Lorio will see them for mental health. So we provide that service. So all the veteran has to do is somehow contact the clinic either physically or by phone, and we'll get you enrolled immediately.
Okay. And that the family member can call on their behalf?
Yes, sir, for sure.
So you'll accept calls from mothers, fathers, wives,
Bring them right
girlfriends?
over, yes.
Okay, very good. All right.
Well, I have some really exciting issues that I want to address as far as our plans over the next couple of years. So let me scoot way ahead with some of these issues. Dr. Hutton, can you kind of bring us up to date on some of the group therapies that we have planned over the next year for the clinic?
Sure. As Dr. Lorio was earlier discussing, SIT, or Stress Inoculation Therapy Group, we've been running with great success. Veterans as well as their significant others find a lot of benefit from that. Additionally, we're going to be having anger management therapy as planned, and also an anxiety and a depression group. And Dr. Pan is going to be running a smoking cessation group at the first part of the year.
That's an incredible expansion of our group therapies, and we find that they're more successful because veterans learn from other veterans. And Dr. Pan last year actually did have a chronic pain group as well.
Okay, we got to take another, is this a weather break?
This is our last break, yeah.
Okay.
Yeah. If you want to call, by the way, you are invited to do so. We'll be back in just a bit. The number is 622-9622. We'll be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. It'll be partly sunny today and milder this afternoon with a high of 64 to 70. Tonight, mainly clear, chilly, lows ranging from the lower 40s in a few inland spots to the upper 50s along the coast. Tomorrow, partly sunny with a high of 71 to 75. On Saturday, times of clouds and sunshine, breezy and warm, high 74 to 78. From the Florida Weather Center, I'm meteorologist Joe Lundberg.
Your home is safe, or is it? AA Lock, Dock, and Security. The name has been a staple in Ocala since 1985. Do you have the right equipment in place to have peace of mind when you are at home or away? AA Lock, Dock, and Security has the right people to install and monitor your home or business. Call today for a free on-site security analysis. Call 867-1965. AA Lock, Dock, and Security, 219 Northwest 10th Street, 867-1965.
Hi, this is JP from Penn Flooring here in Ocala. I would like to invite you to come in and visit our spacious showroom where we have solutions for every style and budget. From wall-to-wall carpet to hardwood floors and tiles, we have an unsurpassed selection of flooring. At Penn Flooring, we've provided quality customer service with a family touch for over 25 years. Visit our website at pennflooring.com or come by our showroom, 1201 Southwest 17th Street, just over the bridge. Penn Flooring, quality customer service with a family touch.
Hey, Matt, I know Sunrise Automotive does auto stuff, but I need some tires for my truck. Can you recommend someone?
Yes, I can. We do that.
No, I mean, I need them installed and balanced and all that.
Yep, we do that.
Well, my son needed his windows tinted.
Yep, we do that.
I need my seat replaced.
Yep, we do that too.
I need a new roof line, and a new spoiler, and a new trunk.
We can even do that too.
Okay, I get it. I suppose you can also do a radio show too, huh?
Well, as a matter of fact, join me every Monday at 10 for auto repair with personal care here on The Source.
Of course you do.
Hi, I'm Leah Caruso with Strive Rehabilitation, inviting you to join me Thursday at 11 a.m. for Health Matters. Ocala Health and Strive have teamed up to bring you the latest information on good health services available to you right here at home. This vital information will help you make informed decisions about your health. So don't forget to join me here at 11 a.m. Thursday. It's news you can use from Ocala Health, Strive, and your friends here at WOCA.
All right, 12 minutes before 10 o'clock, let's return to Veterans News and your host, Hank Whittier. Hank?
Back just talking about mental health within the veteran community and ways to, access it in the VA clinic, and Dr. Knapp is here. A lot of it's about PTSD, but, I did want to talk about how, and again, if I don't, I'll put you on the spot because I know you have the numbers. But, I know you have hotline numbers and you have local numbers the veterans can call.
Yes.
All family members can call on behalf of veterans. So what are they?
Well, the main Ocala clinic number is 369-3320. The mental health area has its own number, which is 547-1583. And if a veteran is ever in any kind of crisis, whether it be suicidal thinking or even just, really needs to talk to someone and feels that they can't wait, they can reach a 24-hour Veterans Crisis Line, and that is 1-800-273-TALK or 1-800-273-8255. And that number is available 24 hours a day, staffed with specialists who can help connect the veteran with, care if they need immediate assistance.
Very good. You got a phone call?
You do have a phone call, and gentlemen, you'll need to put the headphones on to be able to hear the calls. And before I go to the call, just make sure everybody can hear me. If you can hear me talking, then, you've got it. Everybody can hear? Yep. All right. Thank you for calling. Good morning. You're on the air.
Hey, good morning, all. Special good morning to my friend CSM Gary there. I've been under treatment for PTSD for a number of years. Is there ever a point where we're considered healed? And that's the first question. The second question is, in all these years I've been under this PTSD treatment, my wife, as a caretaker, almost has her own PTSD from me. Is there any help or dependent?
You take the first, I'll take the second.
Good to hear, mate.
In terms of being cured from PTSD, some of the research might say that probably not cured, but the symptoms can get better with time, depending on the level of participation in treatment that the individual has had. Unfortunately, there are sometimes vets that say, you know what, I'm just not going to do this anymore, or I'm going to transfer to another VA, and then they kind of forget to continue their care. So some of the symptoms might come back and resurface if they've left mid-treatment. But if they're, consistent with their treatment, you can have an improvement in symptoms with time. So yes.
Right. I have had an improvement. In fact, it's almost like I'm on a maintenance program with a very light drug.
Let me address the second part of your question, and actually it's a coincidence that we just dealt with this issue about 2 weeks ago. We had a veteran that just came back from Afghanistan who was injured, has severe PTSD, and his wife is actually the aide and attendant because he is very disabled, and we got them in touch with the services they need. So I think probably I can best answer your question by saying if you were severely disabled because of PTSD, there is an avenue with Veterans Service Office that we can fill out paperwork and potentially get you some help for your wife as well.
Well, I'm not quite that bad. It's just I've been driving her crazy for all these years.
Okay. Well, I guess
with my own PTSD problem.
I guess the question, I don't know the answer. I'll probably have to punt this off to our specialist. If a veteran has severe PTSD, is there any access for help for the spouse? Dr. Lorio?
Right. There have been group meetings up in Gainesville, but that's too far to travel. And when my wife asked about down here, they told her to start her own group.
Well, one of the things that is an option is starting off through Gainesville is putting in a consult for a caregiver, and that's through Bina Patel, if I'm not mistaken, in Gainesville. And then what they do is they'll refer the consult to the closest clinic for the individual, and then we'll be able to then see the caregiver and provide them psychotherapy to kind of help them cope with what's, with the loved one and whatever issue they're going on. So they can receive the individual services at our clinic, but it has to go through a consult that starts off in Gainesville.
Right.
Called the Caregiver Support Program.
Mm-hmm.
Has to start in Gainesville, can't start at CBOC Ocala. That's what I'm hearing.
Just the consult, yes. Just contacting Gainesville, saying that you're looking for caregiver support. They'll start, they'll initiate the consult, and then they'll refer it to us at the Cascades.
All right. Thank you, sir. Have a great day.
Thank you.
Blessings to you, Major Charles, and your wife.
Good, interesting question.
Yeah.
Well, we only have a few minutes. Let me deal with.
Yeah, you got about 8 minutes.
Okay.
left.
Let me go into a couple other interesting topics. Dr. Hutton, I'm sure that in my private practice, I deal with depression all the time. Do you deal with depression in your practice, and what do you have to offer?
Sure. Depression's frequent, and like I was discussing earlier, is very common with PTSD, but also can be situational. Someone lost their job. In this economy, work is hard to find, especially for returning veterans. And people have what are called predispositions, it runs in families. So, that can be, I'll speak with them and see if they're open to seeing the psychiatrist where medications can help. And usually a lot of the best results are with medication management and psychotherapy, working on providing support and encouragement. But that's really up to the veteran. And so I basically give the options, kind of like a buffet, and they choose what works best for them.
Well, very good. There's two other issues I want to address. One is, Hank, you probably are not familiar with the fact that the VA leads the world in telehealth services, and we even do telehealth for mental health. Dr. Gambrino, can you tell us where we're at with that in the clinic?
Sure. Telehealth is a nice resource because it allows a type of treatment to be delivered either to an area where there's limited access or an area where there isn't a specialist. And we utilize telehealth in both psychiatry and psychology to provide treatment In Ocala, we've used telepsychiatry as a supplement when we were shorter on staffing. We have an inter-facility program with the Miami VA system, and also we utilize the Pittsburgh Veterans Health System for those support services.
How does that work? I mean, okay, so a patient can just call. There are certain numbers they can call and get counseling through that, or how is that going to work?
At this point, most of it is being delivered in the clinic. So there's a telehealth system, basically. It's a video camera, kind of like a webcam you would have. Except a little more sophisticated when it's in the clinic. And they're going to be connected remotely with a provider in another site using that technology. It's confidential, it's private, just like it would be in person. We also do have a limited at-home telehealth program as well. There are certain people that would qualify for that, and that would actually utilize a webcam and the web-based technology, encrypted and everything, so that they could be treated even from home in some cases.
Yeah, so some of our veterans that live remotely or have such severe illness they can't get out of their home, they can be treated at home.
Yeah, that is, and transportation for a lot of them is an issue. I mean, just the cost of it to and from is prohibitive sometimes. Yeah, I know you wanted to take a couple other places, but could I ask a quick question about suicide? And of course, the national numbers are 22 a day. Do we have a profile of who those veterans are that are committing suicide in terms of age and gender, or race, and all those things? Is there a breakdown of that? Yeah, I'm just curious, because I hadn't, the numbers sound astonishingly high to me, and I'm just wondering, have we really done enough study on that to identify, which group is more likely to be in that category, and sort of an early warning system?
I mean, there are a lot of different risk factors. Male, being of the male gender, elderly individuals actually are at higher risk. Caucasian men are at high risk. Multiple deployments is a risk factor. Substance use. There's a number of different risk factors. So, we take it very seriously within the VA. We try to do a lot of screening at all different levels, at the primary care level. Obviously, if they come to mental health, they're going to be screened, but we try to catch it early and get those folks into treatment.
Okay, 3 minutes. Is the rate amongst veterans higher than it is in the general population?
Yes, it is.
It is significantly higher?
Yes, yes, definitely. Well, that's one of the reasons that we've worked so hard to get our access improved. And by going to the 10-hour shifts, we've been able to hire more providers. And so fortunately, we've done okay in Ocala. But now that our access is better, hopefully we'll continue to keep all those numbers down.
Okay. Come the weekend, come Saturday morning, and I've got a veteran out there who is suicidal or depressed. What do they need to do? Who do they need to call?
If the individual is by themselves, and contacting the Veterans Crisis Line would be, because that's a 24-hour service, and if you're a veteran and once you dial that number, you hit 1, it connects you with the VA Medical Center. At that point, if somebody needs to go out to the home, they will send somebody out, whether it be the local PD or ambulance, to be able to pick up the veteran and then take them either to the Gainesville Medical Center or to a local emergency room.
Okay. You want to give us those numbers again before we leave? We're going to get about 2 minutes left. All those hotline numbers and access numbers, if you could.
The Veterans Crisis Line is 1-800-273-TALK or 1-800-273-8255.
Okay. And the local number for the clinic for mental health is?
547-1583.
Okay. All right. Okay.
Very good. Okay, do we have time for one more question?
Well, I think you got one more. Yeah, just one more.
Got 1 minute. 1 minute.
1 minute to go.
Oh, okay. Well, let me just summarize then. We're really excited with what we've accomplished in the last 2 years. Our 2015 plans are the group therapies, such as Dr. Hutton had mentioned. We also have 2 slots for RNs, when we're trying to hire 2 more RNs to support these guys in mental health as well. And hopefully we'll come back with some information for you on our clinic expansion and more space.
Well, I hope so. And we're gonna do another hour show in the after the new year probably and talk about prostate cancer and some of the cancers that are most common amongst veterans. Veterans out there, you heard us talk, and it's not them, it's me. We need to ask our local congressional delegation why this clinic has not been expanded and has not given the funds to expand. We've been talking about it for 5 years. Clearly the numbers are there, and I don't understand why not. So some of us will be calling the congressman's office today and asking that question. So in any case, guys, I appreciate you coming in, and veterans, there's help out there for you. Your family members, the same thing. Call those numbers and you'll get it. And I want to thank you for your service, and thank you guys. God bless America, everybody.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
Oscar-winning director Mike Nichols has died.
83, the newscaster Diane Sawyer's husband, won an Oscar for directing The Graduate.
For God's sake, Mrs. Roth.